Could COVID-19 testing be the way to restart travel? Let's get into it. Airlines and tourism organizations say testing is the answer, and they are making it happen. Opening testing sites at airports, adding test results to passenger records and manifests, and offering flights only for tested passengers. The World Travel and Tourism Council, along with business and airport groups, called on governments to open borders with testing to reduce risk versus waiting for vaccines to end the pandemic. Let's look at the U.S. state of Hawaii, which reopened to travelers with rigorous testing requirements. They say it works. Hawaii was strict, guys. Hotels were rightfully snitching on guests who weren't quarantining. People were getting fined left and right. But since October 15th, Hawaii has exempted tourists with negative test results from strict quarantine, designating which tests and which companies it requires. About 29,000 people have gone back to work out of 150,000 who lost jobs during the pandemic. With an increase in COVID-19 infections in November, the island of Kauai split with the state and reimposed a 10-day quarantine regardless of testing on December 2nd. Hong Kong and Singapore also tried travel corridors and pushed it back to next year because of increased COVID cases. Delta's recently launched a new COVID-tested travel corridor for flights from Atlanta to Amsterdam. Passengers will have to test negative for COVID-19 before and after the flight. For Delta, passengers are given a link to local testing facilities and information on how to provide the results to Delta. The PCR test is conducted at the passenger's own expense. However, the rapid tests at both airports are included in the price of airfare. Passengers will need to provide proof of a negative PCR COVID-19 test taken 5 days before travel, self-quarantine until their departure, take a rapid test at Atlanta's Hartsfield-Jackson International Airport, and test negative before boarding. Arrival at Schiphol Airport, passengers whose final destination is the Netherlands will need to take another PCR test, and with a negative result, they can bypass the 10-day quarantine. Results are usually back actually within a few hours. Until an improved working vaccine is available worldwide, this testing program represents the first step towards international travel industry's recovery. People are flying. The airline industry now has a multinational, concerted, and clear effort to make it the safest way possible. It's about building trust, reducing anxiety, and managing expectations. As I said today, Delta is launching the Rome COVID-free corridor. Like Amsterdam, passengers are allowed to travel to Italy for essential reasons, will be exempt from quarantine on arrival in Rome. I have to return in Italy in the upcoming weeks and just purchased a COVID-tested flight through Alitalia. In my ticket, they said, "We remind you that these New York-Rome and or Rome-New York flights will only board passengers who present at the gate a medical certificate of negative molecular RT-PCR, that's a mouthful, or antigenic test result carried out within 48 hours before boarding, or who on the day of departure undergo a rapid antigen test at the airport and receive a negative result." They then go on to provide the link of the testing site in terminal. And when I looked at the fees for Adams Health Services, their real-time RT-PCR test was at a cost of $179, and an express test is at a cost of $399 and returned in 65 minutes. They ask that you arrive 4.5 hours before your flight. I most certainly can't afford this, and I'll be going to my local clinic that's covered by insurance. In Rome's airport, it's free. Universal healthcare. The cons. 7 people were arrested by French authorities and charged with selling fake COVID-19 test results at Charles de Gaulle in Paris in November. The tests were on sale for $182 to $365. Experts in countries disagree on how much testing and what kind of tests should be required for crossing borders. The IATA acknowledges that testing only minimizes or reduces the risk of spreading infection. It doesn't eliminate it. The organization, which works with member airlines on safety and sets standards for airlines worldwide, is creating standards for a health certificate that would be included in passenger records, similar to passport and visa documentation. Trials will begin this month and into January. I hope this all goes well, and I will definitely report back to you about my actual flight coming up in the next few weeks.
Test 1, clinic in Brooklyn 24 hours before my flight. At JFK, they took my temperature and checked my test before check-in. Not everyone was approved, and if you weren't, you had to spend $400 on a test at the airport. The gate was kind of crowded, but the plane less so. Everyone had their own row. In Rome, we landed and were immediately placed in line for COVID tests. But it was lovely. We were given treats. It was organized. All in all, took 40 minutes. Then I was allowed a flight back to Milan and didn't have to quarantine.